Oh, recording in
Okay,
progress. It's
recording in
recording.
progress. Everybody got the note that it's recording. Thank goodness. All right, so welcome to March 24th, 2025. Uh, Kara, you'll be presenting. Kara Reamer presenting. Amanda, are you observing this one? And Tracy, member, or it's the other way around? Amazing. Okay, Tracy observing, Amanda, group member. I'll be facilitating. That's marvelous. We're going to try to stay in the 30 to 45 minute, you know, area. I think 30 minutes was the idea about the meetings. Um, and general intro, we know each other. It's intervention 521. I'll be facilitating during Kara's presentation. Um, yeah, Kara, what do you have for us?
Okay, I wasn't sure how this is going to go. So I guess this is how
Me
it's
neither.
going. Okay, I'm just going to read my presentation.
Amazing.
Uh, um, so the situation, blah, blah, that's speaking. Okay, my situation I want to discuss for this is about my placement in the recovery house for dual diagnosis LGBTQ plus adults. Um, During my placement, I have been asked to cover for clinicians who have taken leaves of absence for various reasons. This has been awkward for me, and I think the residents at time, and also for due, and also for the residents at times due to the short-term nature of our connections. And I'm also flipping back and forth between different roles, and I think that's a little. I'm wondering if that's odd. That's hard for me. However, I do feel like I've been able to established a rapport with most of the residents that I've worked with and provided them with support and a relatively safe space to share. My challenge now is with a resident who I've recently been assigned. I'm having difficulty connecting with her and I am unsure how I should approach the situation. I feel like I need perspective about the situation and suggestions about connecting with this resident. Um, for the purposes of this assignment, I will refer to the resident as Jay. Jay is a white transgender woman who is 37 years old. She is in the process of transitioning male to female. She entered the program a few months ago. She has been clean from amphetamines, her drug of choice, for 8 months prior to being admitted. Jay has been diagnosed with a depressive disorder, borderline personality disorder, and PTSD. On a micro level, Jay is working with a clinician, me, at the recovery house, as well as a care coordinator. Uh, we comprise her treatment team, supporting her during her stay, and helping her access services. She also has an outside therapist. She reports feeling close to her care coordinator and therapist. She also feels close to her past. Oh, she also felt close to her past clinician, the one who I am substituting for. Currently, we all comprise her support system and are helping her navigate her sobriety. On the meso level, Jay has become an active part of the community at the recovery house, participating in groups and befriending several of the residents. She also has connected with a program that provides services and education to people who are entering or re-entering the workforce. She has an eighth grade education and plans on obtaining her GED. These supports are enabling her to attain education, employment, and eventual housing, elements she has not been able to previously access on her own agendas. On the macro level, Jay deals with transphobia as well as the stigmas of having a mental health diagnosis and substance abuse issues. Jay is a resilient and focused person. When people are admitted into the recovery program, they must earn privileges and freedoms. It's staged, the program is. Upon entering the program, she took advantage of the time and resources and started participating in groups and connecting with therapy services. Jay is bright and self motivated and has quickly advanced in the program, thus enabling her to gain privileges and participate in this job education program. She has goals and is interested in living on her own one day and living and working in information technology or as a hairstylist. I have many thoughts regarding the situation, the difficulty of this situation. One is the lack of stability in the program that Jay has had to deal with. She had been assigned a clinician who she worked well with, and that connection was interrupted. Sorry. I was wondering if my difficulty connecting with her in part may be due to this. Another thought that I have is that I am not in the house very much, and there is a lack of familiarity and consistency because I'm only there 15 hours a week. I am concerned that our difficulty connecting is due. Oh, and then I'm also concerned that the difficulty with the connection is due to an error that I made prior to working together. I did not familiarize myself with her case. I was not I was overwhelmed by my caseload. I had a lot of clients I was working with, and I neglected to spend any time on with her, looking into where all of her specifics. I'm wondering if this lack of preparation on my part has affected her trust in my competence and abilities. Because it's obvious because I ask her questions that I feel like I should know the answer to. So um, that is my presentation.
Okay,
That,
so
yeah, that's
oh
a lot to work with. Amanda, go ahead.
yeah. So I feel like there's a lot of moving parts here. And I wonder, so does she still see her outside therapist alongside you? So
Yes.
and then she also sees her care coordinator, you said.
Yeah, her care coordinator is someone in the house as well, and they take her to appointments, help her apply for different services, things like that.
Okay. And
Yeah.
she's close with them.
Excuse
She,
me?
she feels connected to them, like she's close with them.
Yeah, she's it seems like she's established a good rapport with the care coordinator. They become really like friends sort of.
Mm.
They go out and they chit chat, smoke together, things like that. And she feels apparently she feels good with the clinician, her not her clinician, I'm a clinician, her therapist.
Okay. And I'm curious like what is like the difference in like your role versus her outside therapist? Like what do you target versus her therapist?
Yeah, I think but the way I perceive it, I no one has ever explained this to me, but the way I understand it is that I'm helping her with more immediate stuff in the house, like helping her negotiate different relationships in the house, maybe things that come up on a daily basis because we see each other. Like I see her, I interact with her often, just I mean, like when I'm there. And then the therapist just sees her once a week. And the therapist seems to deal with more like trauma therapy, things like that. We don't really go into that. We more deal with more like day to day stuff, maybe challenges she's having with her recovery, possibly things like that.
Okay. And I'm curious like where do you like what is cluing you into like this disconnect with her? Like what is she like how is she behaving with you? Like what cues is she giving you that you feel like there is a lack of rapport with you?
Yeah, she doesn't want to meet with her. It's pretty with me, pretty apparent. Parent, we have meetings. She doesn't not interested in meeting with me, and when I asked her who she feels like her support team is, like her safe people, like I wasn't in there, and I was, I'm like giving her. I mean, it could be lots of different reasons. It could be just because we are just now beginning to work together, so, that could be part of it too. But that sort of clued me in.
Okay.
So I'm just trying to figure out like uh how much space I should give her, or if it's like something to pursue, or um
Hmm.
I'm not sure how to. I'm just a little puzzled.
So
Have you
What
maybe it's,
I have a
go ahead,
question.
Tracy.
yeah.
Um,
Go.
what um what were you looking for from us?
Yeah, just just that. Like if it seems to you like a situation in which, it'd be better to give her space and just let her have her team, and or if it would be something that would be better for me to um tried to work at for getting, being closer to her. Or yeah, I guess that was my and try yeah, just for some perspective on the situation because yeah, because I'm involved, I don't have the perspective.
Right.
Yeah. So maybe about finding the balance between, like you just said, how much space and how much pursuit of what conceivably could be a repair if the client, in fact, perceived a rupture. Is there,
Yeah.
and I'm curious for either Amanda or Tracy or Kara, just out loud, thinking it out loud. Um, if there were a rupture, if that's something you're perceiving, or if it's just a matter of building a rapport, you haven't had a chance. Do you
Mm.
have a moment? Is there a context in which you can address that explicitly with the client?
If I could, that that may be a good yeah. Let me think.
Does that feel like appropriate and or comfortable and or something you have a chance to do?
I think this is a good idea. I think this may be something that would be a good idea to just address it because it is bothering me. I do want to
Yeah.
be able because she has very little support in her life. I think we're it, and she didn't come in with any support.
Mhm.
So I just want to be able to help her as much as I can. So um maybe that's the thing to do, and maybe she can be asked me. And if I'm not helpful, then maybe she can tell me if she doesn't want me to help her.
Um, uh, when is there a way that you can have a heart to heart with her and ask her how does she think your sessions are going? What does she think about, the therapeutic relationship between you two? Does she feel like maybe she's, getting to know you still? Is she apprehensive to, open up? I mean, I'm just thinking of some questions that you could ask her if she is feeling the same way you are, or if you can get to if she's feeling the same way you are.
Yeah, I think that that would be a good idea too, because it's just a lot of it's my perception and which may not be hers.
Yeah,
Right.
that's definitely a good thing to keep in mind. I was
Yeah, I
waiting
think
for
that's a
there
good
to
idea.
be any silence so I could reach into silence, but we're doing a really good job of talking. So,
And then
I'm
um,
I guess,
sorry I'm moving around so
yeah,
much. I have all
well,
these
no,
animals around
I
me
think
I
that
like
are
it.
we're supposed to be asking you some of these
Yeah,
questions as the group
yeah,
members. There's more questions.
yeah, absolutely.
You guys have
Um,
that sheet, right?
Yep, the solution focused case
Yeah.
consultation. Sure do. I'm not looking at texting on my phone. I'm looking at that list in a note as you're not winging it because I thought about how would I do it, and then the moment we started the meeting, it flew out. So I was like, Kara,
So,
present, fill the space. Go ahead, Tracy.
so yeah, like I love the one question in the book, and I actually use this for my patients a lot. Say you were go to sleep tonight and you had some miracle happen overnight and you woke up tomorrow, a miracle about the situation. What would that look like to you?
uh well, I would feel like there was some sort of opening, like yeah, and it just feels a little stiff. And I am not sure um if that's possible. I do remember the clinician who left, and I did sit in on one of their sessions. I actually am not really familiar with borderline personality disorder, so I am not sure. Yeah, I'm not. I'm just not familiar with it, and I'm not sure because the clinician recommended that I uh focus on our feelings, and I think that's I'm what because I am like I go right to the feelings, and so I don't know if that's like that's hard for her because she apparently doesn't want to deal with them. Um, which
Mm.
is understandable. She has substance abuse stuff. So uh Anyway, so my ideal would be that there would be some sort of opening and some sort of comfortability with that, and I don't feel like that's there.
Okay.
Yeah,
I don't feel for either of us.
I think that facilitating that conversation and opening that door and being transparent about, hey, this is what I'm seeing. Like, is this true for you? Because this is how I'm feeling, and recognizing like because I remember you said earlier that she had had a rapport with the person that you're covering for. Was that what you said?
Yes.
Yeah.
Uh, Apparently she had, because she had listed that person as part of her team,
Yeah,
like
so
her
like
safe
that
team.
that could be like causing some resistance towards you, that it's like, all right, well, I had a rapport with this person, like now you're here and I already have rapport with all these other people, like what do I really need you for when I already have, what I mean? That's just like, imagine,
Yeah.
I don't know what she would say, but like, just kind of like opening the door for her to say whatever it is that she's feeling, and just like kind of calling out, what, there's something here. I don't know what it is. I don't know exactly, but how can I help you? What can I do for you to make this better? Like and just being like honest about wanting to help her and like wanting to be supportive to her in whatever way you can. And I know that might be difficult to do at this point because our placement is coming to an end. I don't know if like
I
like
know.
in terms of like just being like, also where I don't know about for you, but like for us, like for me and my placement, we're talking about termination now. So I think it's kind of a tough line to like build rapport for a place also where you're leaving. It's kind of
Mhm.
Yeah.
I think a tricky line to teeter, which I don't
Yeah.
want to get that whole other element, but I know that's like, something I'm having to address. So it might be kind of difficult to be like, what can I do for you during the time that I have? Because I want to help you. And like I sense this. Does that make sense?
Yeah, it does.
I wonder if there's an element of elements of grief and loss for her, of the counselor that left, that she was working with and had that rapport with. And I wonder if anyone has addressed that with her or asked her about it or directly mentioned.
Yeah, I don't think anyone has. That's a really good point. That would be,
Even, yeah,
yeah.
just as a thing. Especially, Amanda, that was a really fine point about, we have what, 6 or 7 weeks left, maybe six.
Yeah.
So I wonder if there's necessarily, there's only so much rapport you can build in that time. And at the same time, I'd say, Kara, that's balanced by a lot of like authenticity. I feel like you legitimately do want to connect with her and you really want to help her, not just because you're an intern, but because you have taken the time to write this up and present it, right? And
Mm-hmm.
you've really taken the time to think about what's going on for her. Maybe that noticing can open a door because there's about to be another changeover.
Yeah. I know it's an odd time
Mm.
because I was talking to someone a different person last week. I was working with them and I was like, yeah, I'm here for you. And in my head, I was like, for 5 weeks.
Yeah,
But it's
and
like,
that seems like a fair point to bring up. It seems like it just I love that you said transparent, Amanda, right? Because transparent and authentic really go together. Like, this is the position I'm in. I'm in for this amount of time, and in this amount of time that I'm here, I would love to be a support. Like, my job and what I truly want to do is be a support for you in whatever ways we can make that are relevant to the time that you have there and the
Mhm.
way that you interact. And that distinction you made between the quotidian, right? These daily, you're there 15 hours a week, you're in the place, right? And then when clients see practitioners outside of the place, it's sort of their existential big picture, right? They're once a week or twice a week or whatever therapeutic schedule. So that's a big difference. You might have a lot you could accomplish in 5 weeks or 5.5 weeks. And Tracy, you are very focused in addiction and substance abuse
Mhm.
stuff,
That's
right?
my specialty, yeah.
Yeah, it's your specialty. Like you're already in that. What else might you think around connection and rapport and repair,
Um,
if there is repair to be done? Maybe there's not. Who knows?
I don't necessarily know it's broken.
Right. That
It's
I
definitely
may
not,
not even be broken, may just haven't been
yeah,
built yet.
I don't think, how many sessions have you had with her?
Just a few.
Just a
Yeah,
few.
just a few. Yeah.
Yeah, it's kind of too early to tell that.
Mhm.
It's too early to tell, but her, what seems to be her main presenting problem? Is it the substance use or the mental health?
Well, you know how it usually like circles that she has the she okay, she I think she started taking a she's ADHD. She started taking amphetamines when she was young because she was prescribed, and then she's continued them. And so, but now she has hallucinations. She has hallucinations. So now I think that's what prompts the cravings. I think it's all related like that.
Right.
A
Is she
vicious
does
circle.
she, you feel like she's stabilized? Does she need to see a psych provider?
But she's hooked into that. She's taking medication for her diagnoses.
Anything for
Um
cravings?
um yes, she is taking something for cravings.
Good.
But yeah, she's still having them, and we were talking about that, and she just says resolved to always having cravings. So we discussed that, but that was um yeah, that was a hard conversation for her to have, it seemed like,
Yeah. Um,
to entertain not having cravings.
what about have you asked her um what she is hoping to get out of therapy from whether it's from you or from the whole team?
Oh, well, she wants to deal with her. I know what she wants with her therapist. She wants to deal with her past trauma and stuff. She has a lot to deal with there. I'm not sure when she wants to get from me. I've asked her how I can help her, and she says that she doesn't offer anything up. Um, yeah,
Mm,
it just may be a really it just may be an awkward thing for me, but I think that situation for me, but I think that I think it would be best for me just to be transparent about what's going on for me and what I'm noticing. And maybe I can't, I think I have a hard time not being able to help somebody, even if they
well,
don't want it.
you know what? To be honest with you, not everybody connects.
This is true. Yeah, see,
I've
I am
had
new to this. I mean,
I've
to the
been
therapy.
I've been fortunate to get some people off of my caseload that I was just like, oh, thank God, and I hate to think that way, but sometimes the connection just is not there. But
Hmm.
I think this case that you brought, you're I think you might be prematurely uh or maybe anticipating, that it won't go successful, but you've got some good time. If we've got 6 or 7 weeks and you're going to see her once a week.
Yes.
Yes. Um, for that to repair itself or not
Hmm.
repair itself, but to see some growth. That you haven't had enough time to have growth right now.
Hmm.
Yeah.
Good point.
There may not have been even time for anything to get broken that needs to be repaired. I think that's a super salient point, Tracy, that hasn't been growth yet because you've had like 5 seconds.
Good point. Yes. I may just be anticipating that yeah.
Taking that looking for trouble when it's going the worker's way a little too far.
Yeah. Um,
Um, Go ahead. Whoever just said
no, so one of these questions, so what are you already doing that is on track or is desirable for you? What's working well? Like we know what might is not working well for you, but what's working well
Oh, in the placement, I can't remember that question.
with the this new client
Oh,
of
with this
yours?
person. With this person. Uh, well, I'm not, we were able to talk about her addiction some, and she did talk to me about the hallucinations. And, um, and, uh, I did offer that, that maybe I could be the person that she just comes and talks about that with and may help her with her just to get through that. It won't, I don't think
Right,
it'll cure her hallucinations, but help her get through it at least. So
right.
I felt like that was I thought that was good. Good interaction.
Uh, I was thinking maybe you could do some research on some evidence-based practices that could help with hallucinations.
That's a good idea. That's a great idea. Thank you.
Yeah, because there are some out there. I think I can't put my finger on it, but we had this in a case conference a couple months ago, and someone's client was having bad hallucinations, and another clinician sent us out an email. You know what? And if I can find it, or if I can talk to that clinician, I'll send it to you.
Oh, thanks.
Okay. Because I know there are some uh things that you can do, some activities or exercises that will help hallucinations.
Thanks a lot. That's a really good suggestion. I hadn't even thought about that. I
Because
didn't
I've
know
heard
that.
you mention it a couple times now, and that might, gosh, I can't imagine having hallucinations. That's got to be really scary for her.
Yeah, she said that white noise sets it off, which is
Oh,
weird.
oh,
Yeah,
oh,
they have this air thing where they smoke and it's like white noise.
Mhm.
So the only solution is for her to stop smoking, but I don't think that's gonna happen. So-
oh. There's no white noise in your office? Because I've got the white noise coming out of my ceiling in my office.
No, we do outside our office, but I could just turn it off. But yeah, that's
Oh, that's good.
uh
Because I'm like,
she
that
hadn't
could be triggering.
she didn't mention that. She mentioned the smoking area.
Gotcha.
Yeah. Thank you. That's really helpful.
Hmm.
Amanda, did you have any thoughts during that sequence that like stuck out to you?
I think Tracy, that was a wonderful suggestion, and
Yeah.
it just really strikes me how much you care,
Yeah.
Kara. And I think that like that first and foremost is the most important thing, and whether or not you connect with this specific client, I think it'll get somewhere. It might not get to the exact point where this is like you know, your shining star of your placement, or maybe it will be. Who knows? There's no saying like where this is going to go, and you still have time to explore it. But I think just being present and being real goes a
Hmm.
long way. I think
Mm,
I think clients can sense when someone is being like authentic with them. And I think bringing that to the table and kind of acknowledging the table and what's on it will go a long way. That's,
mm,
I think just bringing yourself and being real is going to make an impact. I think what Tracy said before is like you don't connect with everybody, but it's so early to tell. So I don't think
mm.
you need to stress as much. I wonder if because I had this thought earlier where was some of this anxiety born from her listing off the her safe people and you not being one of them?
I was bummed out. I was like, oh man. I mean, I wasn't surprised because I knew she didn't want to really meet with me. But yeah, that was a bummer.
Yeah. I would have felt the same way. I would have been like, oh no, is it me?
Huh. That's
Not
a
me?
list I would have wanted to be on.
Yeah.
So like the authenticity that you really care, the putting what's on the table. Tracy pointed out the figuring out if there's anything more you can glean from her that she specifically wants and doing a little research around hallucinations or your own research around BPD. You may not address that directly with her, or you may address the diagnosis she had, not because you're in place to treat them, but because it could be another indicator of your curiosity and your openness. I mean, those are diagnoses that, as far as I know, you're working with a lot of folks whose diagnoses carry a ton of stigma. And you already mentioned the number of things that they're facing, these just adverse waves all around them. So you have a lot to proceed on. And maybe part of that authenticity is also acknowledging the short time frame you have
Mm,
so that it's very realistic. It doesn't mean you're limiting yourself from being potentially helpful or being a
Mm.
source of safety and support. It just means you acknowledge that you're not trying to make miraculous help happen. You just really want to be there for them.
mhm,
My
That
field
seems powerful. Go ahead.
my field
I like it.
supervisor, when we were talking about termination, advised me to be like, okay, I have 6 more weeks. We can talk, it's different on my placement, but like say we have 6 more sessions and kind of putting it that way. And it's like, I want you to be open with me about whatever it is we haven't covered so far. And she
mm,
said, just even sometimes putting that, like kind of putting it into those words and being like, all right, our time is limited, makes people more open that they'll start because it's something I don't know exactly what it is, but like I haven't personally had this experience yet, but like some of the other interns have, where all of a sudden they're like, it's like a doorknob confession,
Oh,
where
yeah.
my hands on it's like we're walking out the door, but like just before we leave, I need to get this thing out. And, it might, like it's acknowledging the limited time may or may not like have her open up a little more. It's,
Mhm,
and I think
hmm,
it's also good for her to know because it's, you don't, I mean, like you have to tell her it's like obviously, but putting that on the table might cause her to open up.
hmm,
Yeah.
Also, don't be afraid to ask her the miracle question.
mm.
It's worded better in the book. I can't remember how exactly it was worded, but I'm sure you could Google it, it'll come up.
Well,
Yeah,
and
they use it at the
both of
recovery place.
those, yeah, and both of those things that Amanda and you, Tracy, you just said, give her open a door, whether she chooses or not, is
Hmm.
just asking it opens it up,
Yeah.
right? Containing, making it like temporarily anchored, right? You have 5.5 weeks or 5 weeks or whatever, and potentially asking that miracle
Hmm,
question, curiosity, and it opens the door so she has a chance.
Yeah, it might give you something to work on. Um,
yeah, that
you
is
know.
brilliant. That is brilliant with like her sobriety. That would be a really good question to ask. That's a really good idea.
And Mimosa, you had to record this because you've got to submit it.
Absolutely. I
Oh,
know.
that's right. You have
I
to.
know, but you know what? It seemed like good practices to make sure it was okay for everyone. If
Yeah,
anyone needed the option to have their camera off or, was like, no thanks.
Mm.
Um,
Bad
but
hair day.
how are you feeling, Kara, prior to when we began to now? Any
I
difference?
feel, yeah, I feel really good. I think in my head it's like really complicated. It's been good to like, I've actually talked about it in this class. I also talked about it in seminar class because it's obviously weighing on me. But I think it was just complicated, and actually you gave me some really good suggestions, and I'm not gonna, I'm not looking to fix you, but I uh I think I there's some stuff I can do. There's some room to grow with this, and and um just because it's uncomfortable doesn't mean I can't work with it. Yeah.
That sounds like a really powerful observation, that there's always a next step, and that just because it feels uncomfortable, you can still, you have options.
Mm-hmm.
You
Yeah,
definitely have things you can ask and do and say and
I
sit
really
with.
appreciate all of your suggestions. I really do appreciate you listening to the situation, and yeah, all of your input was very helpful.
Alrighty. Thanks, group.
Okay.
I'm gonna stop the recording.
Okay.
Is everybody okay with stopping? Remember how to
Mhm.
stop the recording? Anybody remember how to do that?